In this video, we're going to cover how to best remove the IV and the tape from the patient's arm and hopefully be causing the least amount of pain as possible. And because all the IV tubing tape is glued to the patient's skin, and especially in this case when there's some significant amount of hair, we want to be cautious. And the best thing to remove the glue is alcohol. So I have several alcohol prep pads here, and I'm going to take one of them and start kind of wiping the edges of the tegaderm until it comes up and is loose. And then once I have a little tab here, I can pull the tab with one hand as I go underneath and loosen that tape, preferably in the direction of the hair, that the patient's hair is growing, to make it as least painful. So once I get to about where the insertion site is, I don't want to pull it out quite yet because it's still attached to the other side. I'll move to the top, and I can feel that my alcohol prep pad is drying up a little bit, so I'll use a second one. And I'll move my way all the way around that tegaderm. And as you can see, it comes off quite nicely. Are you doing okay there? Is this painful at all?
No pain.
Great. That's what we're going for. This one, this tab, can you turn your arm over a little bit? It's just a little bit over there, so we'll get underneath that tape. Good. You can relax the arm again. And so as you can see, it's a little tedious, but it doesn't take more than a minute or two, but it definitely saves the patient from a lot of discomfort. Now, once I get it loosened up all around, I also make sure that I get the bottom side of it, and even if the tape starts to go back onto the patient's skin, it usually doesn't adhere. Then I can hold it with one hand, grab all that tape, make sure it does not attach to the patient, and then I need to also have my gauze pad ready to put pressure on the site. So I'll remove the IV, press the gauze pad there. In this case, I'll remove the IV, I'll inspect the cath log, make sure it's intact, and I can just put it in my glove and then dispose of it after that. So now I hold a little pressure here, or I can actually have the patient help me with that. Could you hold pressure here? Great, so we'll hold a little pressure, just like after a blood draw. And then we could go ahead and secure that with another piece of tape. I like to always put a little tab there to make it easier to peel off when that time comes. And we'll go ahead and let go. Go ahead and tape this in place. If you can hold pressure here for another minute or so, it'll make sure that it clots. And we're all done with the most comfortable IV tape removal that we can find. Thanks for watching.